Hi, everyone. This is Dr. Sarah Boston. My favorite animal is the dog. Specifically, I love herding dogs of any type, so border collies and heelers. I think they're wonderful. And I guess if I was an animal, I would be that dog because I love organizing things and running.
This is Pawprint, an animal rescue community, episode 3. I'm Harold.
I'm Nancy.
Today's guest is the very talented Dr. Sarah Boston. So, what do you think a veterinary surgical oncologist does?
Must have something to do with surgery and cancer.
They're cancer surgeons, that's right. We got to meet Dr. Sarah Boston. She's a veterinary surgical oncologist at the University of Florida. She's written plenty of scientific papers on surgery and oncology, but what makes her unique is that she's actually written her own book, not only about the dogs and cats that she's treated over the years, but about her own battle with cancer, thyroid cancer in this case. If you want to learn more about Dr. Sarah Boston, go to our show notes at thisispawprint.com/3. That's the number 3.
I'm a veterinary surgical oncologist and at the University of Florida. And what that means is that I'm a specialist in surgery, and I do exclusively cancer surgery in dogs and cats.
When you see your patients, right, these dogs and cats, are there currently any trends that you're noticing?
I think there's a few trends. I mean, one trend which I think everyone in the animal world and veterinary industry recognizes is just how much closer people are becoming with their pets and just how much they are considered part of the family. And I think with that comes a increased desire to do more and to treat cancer more aggressively, which is why our field in oncology is really growing quite rapidly in veterinary medicine. And then I think another trend which goes hand in hand with that is that we have more sophisticated equipment. So we do a lot of CT scans in our patients now, where in the past we might do an ultrasound and an X-ray. And that allows us to stage cancers more completely. So staging means to look at where else is the cancer in the body and what does the actual tumor itself look like. And it also potentially will allow us to find other cancers or other diseases. And so sometimes we are working a patient up for one cancer type and we will find something else incidentally, which feels like really bad news, but if you think about it, it means we're detecting cancers earlier, and so there's more we can do for those patients.
Tell us a little bit about how the heck did you get into, how did you get into animal medicine, and then how did you get into oncology of all things?
So I was one of those veterinarians who has always wanted to be a vet, and since I was 6, so I can't really remember ever considering any other profession, and I think there's a lot of people in my profession that if you get talking to them that feel that way, that they just always knew they were going to work with animals, always felt compelled to be a veterinarian before you knew how to spell or say veterinarian, and just because you had such a strong connection to pets in your home or other animals that you were exposed to. So I was definitely kind of one of the kids that was in that camp, and I volunteered in a vet clinic from a pretty young age, and I was exposed to more traditional general practice style medicine. And I think because of having a long exposure to general practice, once I got in my 20s and I was in vet school, I started thinking about, was there anything else I want to do? And I got distracted a little bit, as a lot of 20-year-olds do, with wildlife and thinking that would be pretty cool to work in conservation and wildlife. But then I was exposed to surgery as a third-year veterinary student, and I think that's finally what captured me and decided that I really wanted to specialize in that field and be what's called a small animal surgeon, where we train in a residency program. It's a 3-year program to learn all aspects of surgery. So learn about orthopedic surgery and soft tissue surgery, neurosurgery, and oncologic surgery. And then kind of within that, I had some mentors that were subspecialists, I guess, in cancer surgery. And I just became very excited about that field. It seemed to fit the best with my personality. It's an exciting field to be a part of. There's a lot of creativity that is actually asked of you if you're doing oncologic surgery, and you definitely need to be outside of the box in your thinking. And so I think all of those things really appeal to me. And also, as a general rule, these are usually dogs, but they're pets that are very loved in the family. And so most of them are really lovely dogs, really lovely patients to work with.
No kidding. Wow. Give us, in your own words, what's your definition of cancer? How does cancer actually occur in whether it's humans or dogs or cats? And what are some of the things that we as pet owners can do to kind of help early detection?
Great questions. Cancer cells come from our own cells. So they are cells that have come from normal cells that have mutated. And so there's different things that will cause those mutations. And sometimes it's a genetic predisposition. Sometimes it's being exposed to radiation, cigarette smoke, different things in the environment. And so we don't always know even why a particular pet or person develops cancer, although some of the cancers that are, we actually do know the cause and effect. We know that certain cancers are genetic, some cancers are caused by cigarette smoke, but we don't always know the actual cause. But what is universal in all cancers is that cells that are normal in the body usually will have mechanisms to control their growth. And they also will normally die. So they'll live for a certain lifespan, they'll reproduce a set number of times, and then they will die. And that's what a normal cell in our body does. Cancer cells have found ways to evade those control mechanisms. So they're genetic mutations that occur, however they occur, to get them to be a cancer cell. They can live forever. They can replicate multiple times, and much more than what a normal cell would do. And so they start to grow out of control as these cells replicate. And they also can figure out ways to live in other places in the body and be invasive. And so those are all mutations from a normal cell. Usually the aggressiveness of the cancer, our pathologists can give us some idea of how aggressive a cancer is going to be based on some of the features they see under the microscope. How bizarre those cells look. Do they look like the cell line that they came from originally, or are they so bizarre that the pathologist can't even tell us really what the cell line of origin was?
Yeah, yikes.
Do they see that these cells are, do they see that there's a lot of what we call cell replication or mitosis? That's when cells are dividing. And if a pathologist looks under the microscope and they see a lot of cells in division, that's a fast-growing tumor that's aggressive. And so some of those features will help us out when we're telling a client what we think the prognosis is and what we think the best treatment is for that pet. But essentially, a cancer cell is a normal cell that is mutated to the point that it grows beyond normal control mechanisms in the body.
For a pet owner, what would any sort of common sense things we can do to try to provide early detection?
Yeah, absolutely. I think the one that is probably the easiest for a pet owner to take control over is that because everyone's always touching their dogs or brushing their dogs or petting their dogs and cats, if you find a new lump or bump under the skin or somewhere, if you see it in their mouth, anything that's new, a lot of times in older dogs, those can be benign fatty tumors and nothing to worry about. But really, there's no way to know that unless you put a needle in it. And so, I would say anytime you find a new lump or bump on your pet, you want to take them to your family veterinarian and have the veterinarian put a little needle inside to take a sample of the cells. We call that a fine needle aspirate. And then either the veterinarian may look at that themselves in their own hospital or send that to a pathologist. And the pathologist will tell you, is that something that's benign that you really don't need to worry about? You could remove it if it's causing problems for the pet, but it's not a cancer. Or is that something like a sarcoma or a mast cell tumor or a carcinoma that really should be removed? Because there's a lot we can do for dogs with cancer. There's even cancers that can be cured with cancer surgery, and especially if we catch it early. So if you catch a cancer earlier, it's smaller, so it's easier to remove it with complete margins, and also it has less chance that it might have spread somewhere else. And so I do think there's some pet owners out there that get a little bit paralyzed and scared. They find a lump. Maybe they know it's not right, it's growing quickly. It's something about it they know is not like the normal fatty lumps that their dog has had before, but they get a bit paralyzed thinking, well, there's probably nothing that they can do. And, I think something important to keep in mind is there's actually a lot we can do now for pets with cancer. But you need to work on detecting it early. And then there's other signs that older pets will show, and sometimes they can be very nondescript. So an increasing lameness, really bad breath, not wanting to eat or drink, developing diarrhea or vomiting, maybe developing some pain, or, some of these pets just don't want to interact with the family anymore. Just there's a change, and it can be very difficult to figure out exactly what's going on. But sometimes that's not just old age, and I think a lot of things we might chalk up and say, oh, well, that's an old dog, and that's just the way it is for them. But sometimes there's actually an underlying issue that we could detect with a really good physical exam and maybe some imaging tests and maybe help them, with surgery or other treatments. There's a lot of different treatments for cancer now. So that's a little bit harder because it's kind of those nondescript things. But I think people who have a pet that's part of their family that's sleeping in their bed or that's, with them all the time, when they're different, when something's wrong with them because you kind of have learned living with them all those years what their normal behaviors are. And so if you're seeing a deviation from the normal behaviors, I think you've got to think, well, could it be a health problem? And is it something that I could look into further and get worked at?
I haven't suffered cancer myself, but humans, treatment would be a mix of surgery, chemotherapy, radiation therapy. I mean, there's so many different treatments now. What in general is the way we treat animals?
Yeah, so it's actually similar to in people. So at the University of Florida, our group there's surgical oncology, which is what I'm part of, but we're part of a bigger team. And so we have medical oncologists that primarily do chemotherapy, but there's a newer field called immunotherapy where we're doing cancer vaccines, which is part of what medical oncologists are also a part of. And then radiation oncology, which is also, that's another team member for us. Because sometimes you need multiple approaches to treat certain cancers, or sometimes, the radiation is more appropriate than a surgery or vice versa. And so it's really good to have a team approach to this so that you can talk. We talk about all our cases together as a team and then come up with the best treatment plan for our patients.
That is amazing. I just never would have thought of that. That's incredible. Maybe give a little pitch for University of Florida. What makes the University of Florida Veterinary Department special?
It's not the only one, but there's not a lot of centers that have all of the services integrated as one. And so we're rounding together. So the surgical oncologists are on the floor with the medical oncologists and the radiation oncologists. So we share all the cases. We all know what's going on with these pets, and we have multidisciplinary rounds every day. And then our whole team will meet at the end of the week to discuss all of the cases to make sure that we're all on board with the best plan for that pet. So I think that does make us unique at the University of Florida. Colorado State University is a much more established program compared to ours. It's actually where I did my surgical oncology fellowship training. And, we've modeled alongside with them as far as, having a system where we can have that integrated care. And there's other centers that are starting to develop that as well. But it is really nice because sometimes before you start a treatment, it's really nice to hear what does the radiation oncologist have to say? What does the medical oncologist have to say? Is this the best plan? Because a lot of the plans are going to incorporate all the specialists at some point, and it's really important to figure out when is the best timing for these things.
Okay. 2 more questions, and then I want to move on to your book that you wrote. First question is, what's the largest animal you've operated on and the smallest animal you've operated on?
I have to think about that. Well, I guess I would have to say a horse because I did do a procedure on a horse with a squamous cell carcinoma of the eye, and that's not very common. And so, but because we're at a teaching institution and I was at the University of Guelph before I came down to Florida, we will have exotic animals or large animals that we will sometimes help with. And so I guess I would have to say a horse is maybe not the most exotic, but probably the biggest.
Yeah.
And then the smallest, I did surgery on a bat, so a bat with a sarcoma of the wing. So I think that's the smallest. How
the heck did they find a sarcoma on a bat?
Well, there's a lot of wildlife in Florida at zoos and privately owned. This is a rehabilitation conservatory that's in the area, and so they had some bats that were developing some issues with cancer, and so they're well taken care of. They're the bats that are at that conservatory, and so I ended up taking care of one of their residents. But we have exotic veterinarians here, which is a very strong program here, just because Florida, for better or worse, they have a lot of people that have exotic pets here, big cats, monkeys, those types of people that own those privately. And then there's a lot of zoos, and then of course Disney. So there's a lot of exotic animals in the state of Florida.
Gotcha.
And our team here, they provide a lot of the care. They're excellent. And so sometimes they'll call me and say, "Hey, Sarah, we've got a bat, we've got a monkey, we've got, whatever it is that they're working on." And it was a little bit of one of my first loves when I was in vet school as well. So I'm always happy to go in and help them, but it's definitely not my normal day. My normal day is really probably 70 or 80% dogs, and then the rest is cats.
I mean,
which is also great because those are animals that I love working with every day.
Oh, sure. That comes to my last question before we get onto your book. Any kind of stories you can share? Maybe a special dog or a special cat who really had an impact on you, made a difference? Well,
I guess this kind of transitions into my book. I've been a vet for almost 20 years, and so it's not to say that there's just so many stories. And I'm hoping to write another book about that to incorporate some of those stories. But
sure.
there's a dog named Carney, and I think I can say the dog's name because the owner gave me permission to use her name in the book. Mm-hmm. And this dog had osteosarcoma, and it was a very special dog, but also a special owner who would do anything for her. I mean, he was just, that was the love of his life. And he drove up from New York to see me in Ontario, and she had some issues. We attempted a limb salvage with her, and in the end it failed, and she had to have a limb amputation, but he was graceful through everything. And so was she, I guess. Mm-hmm. And so ultimately she died of her cancer because we don't cure osteosarcoma in dogs, but she was a pretty special dog. And there's another dog I had that I also wrote about her because she was blind, and she used to go rollerblading with her owner. I don't know how she did that. She just had other senses, and there was just something really special about her. She had before I met her, she had glaucoma in both eyes, and so both eyes were removed because of that. But the owner would take her on a leash on rollerblading trails, and she would run ahead of him and seem to know where she was going, which I just don't understand that. But she just had other senses. Yeah, and I would walk into a room, and she'd start wagging her tail, and I don't know how she knew I was there. And she actually, when she came to me, she had a tumor on her head. The owners had just experienced a house fire, and she woke up all of the owners in the house.
What a miracle. Whoa.
Isn't that amazing? Yeah. So when they saw me with her, they had literally nothing. Like their whole house, everything was gone. And they said, we have nothing except her. And we're alive because of her. But yeah,
Gotcha.
She was just, I mean, amazing. She didn't have eyes, but she was just like this really really, I don't know. She just had an amazing perspective, and she was very perceptive of everything. I loved her. So, but I do really love a lot of the patients that I work with. And so it's not to say just because those two come to my mind that there's not other dogs that are really special. I actually just did surgery on a dog with an adrenal tumor. And she was just so smart. And she was just such a smart dog. You could just tell. And her presenting complaint from the owner was that, she just had these nebulous signs of not being right. They weren't quite sure what was going on with her, but she used to run with her owner every morning. She started jumping up on the owner when he was trying to take her for her morning 6-mile run. She would jump up on him when they started the run and run back to the house, and she could open the front door. So she'd open the front door and shut it behind her because she didn't want to go for a run.
Wow.
So yeah, just an amazing dog. And then the other thing what she started doing in the hospital is she got to know that if I came to feed her, or if the student came to feed her, it would just be food. But if the nurses who wear blue scrubs came to feed her, they would hide pills in her food, so she wouldn't eat for them.
Oh my goodness.
So
Smart dog.
Yeah, just a really smart dog. And so, that's really cool too, because you will see, depending on the dog and their breed, they just all have different personalities and different levels of intelligence. But this dog was just a highly, highly intelligent dog, very perceptive, incredible facial expressions. She had a big surgery. She went through a lot, but, in the end, when she went home, she was literally smiling. She's just an amazing dog. So yeah, but that happens all the time, honestly. There's just, we get to take care of some pretty lovely pets here.
Right. So that's a great segue into your book, Lucky Dog, a story really that involves not only animal health, but your own personal health. Give us some stuff about Lucky Dog.
Sure. So, I didn't go into treating cancer in animals because of having cancer myself, because that happened later in my life. But ironically, as a veterinary surgical oncologist, about almost 5 years ago, I found a mass in my neck just when I was getting ready for bed. And really because of what I do, I knew it was in my thyroid, and I knew it was new, and I didn't think it was good. It felt like a thyroid carcinoma that I have treated in dogs. It's exactly what it felt like to me. And then also, I joke about this in the book, but I put cream on my neck twice a day because I'm so paranoid about wrinkles. And so I touch my neck all the time. And so I knew, and I recommend everyone does that actually, because I knew it was new. And so there's a lot of other conditions that are benign that you can develop in your thyroid that you would feel a mass. But I knew that it wasn't there, and it suddenly was there within a couple of days. And so that gives you a lot of power and knowledge about your own body. And what really got me writing the book was I was living in Canada at the time, and I expected when I went to my doctor with a fast-growing mass in my neck that I would get immediate action because that's what my dogs get, and I didn't get that. And it was very surprising to me. I was very sort of taken aback that I couldn't get an ultrasound for a week and a half. And ultimately, my husband's a large animal vet, and I made him bring home his ultrasound machine that he uses for breeding horses and cattle, because I just wanted to see what was going on in my neck, because I was panicking, and I did a lot of reading and just had my own knowledge. And I thought, well, if this is a cyst, I'm just panicking for no reason. And I knew I could tell the difference between something that looked more like a benign cyst versus a thyroid carcinoma. And so I ultrasounded my neck myself because I didn't want to wait for the ultrasound. And what I saw to me just looked like a thyroid carcinoma. And that sort of started the whole journey. It ultimately took me from finding a fast-growing mass in my neck to having my first surgery. It took 2.5 months.
Right, a lot longer than you would think.
Yeah, I mean, in a dog, it would be 2 to 3 days, honestly. And so that was frustrating. And then it took another month to get my histopathology report back to ultimately. So I thought I had thyroid cancer for 3.5 months, but I was really literally the only one who thought that, because multiple physicians told me that it was going to be benign and made me feel a little silly, like a little bit of a hypochondriac, which I think that's kind of what got me writing. I mean, I had all that time to stew about this question of what was going on with me, and really this comparison of what was going on with my patients, because I was working for most of this time. And so, I would have these dogs coming in for even a thyroid carcinoma or other tumor types and be getting them treated really quickly. And ultimately, I ended up just writing out of a bit of frustration and also just my need to make myself laugh and entertain myself and entertain my friends and family. So that's really why I started to write. It was just kind of this cathartic thing that I was doing because I was sort of in limbo. I think if I'd been in the States and had good insurance down here, it wouldn't have been a book, because I probably would have had surgery quicker.
It would have been a pamphlet.
It would have been a pamphlet. I would have maybe one essay. I would have had a lot less time to think about these issues and think about how it feels to think you might have cancer and what does that mean for your whole life. And so I wrote about it, and the book is funny, even though, I mean, I laugh when I say that, because I tell people it's about me having cancer and it's about my patients that have cancer, and then I always feel like I have to say, but it's really funny, but it actually is. And that's a strong theme in the book. The book's called Lucky Dog, How Being a Veterinarian Saved My Life. And I mean, one of the themes is, like, if you're going through rough times, you just have to find a way to make yourself laugh. You just have to find joy, because it will make it easier what you're going through. You're still going to have to go through it, but it will make it easier if you can just sort of find the humor in the ridiculousness of a wait time of 2.5 months. You've just got to find a way to make that funny. And so I sort of set out to do that, but I wasn't writing a book at the time. I was just writing. And then I sort of realized after, I guess I was about halfway through, I thought, well, this might actually turn into something. And then I literally just got very lucky, and I had a chance meeting with an author who got me in touch with House of Anansi, which is the publisher in Canada. And, he said, I'm going to put you in touch with the best publisher in the country. And he was right. I mean, they literally are. They're wonderful for a first-time author. They gave me a ton of support and helped me create this book. And it's been amazing. It's been an amazing journey. And I've had all different types of people reach out to me, because the book, depending on your perspective, the book, I think, speaks to different people differently. So the dog lovers out there really hang on to the stories about the dogs, and some of them are about my own pets and some of them are about my patients. But I think that resonates with the people that really love their dogs. And then the veterinary community, I think this book is another voice for what we do as veterinarians. And I think that's always a good thing, because veterinary medicine is a little bit mysterious sometimes, and I think sometimes we're a bit misunderstood. So I'm very happy to be a voice for the profession. And then there's the thyroid cancer survivors, and then the cancer survivors. And I think there is a commonality. What anyone who even thinks they might have cancer goes through, all the way to the people who have very aggressive cancers. There's a similar thought process that everyone goes through. You're facing your mortality. You're sort of thinking through these issues and questioning how you want to live your life and kind of what it all means, really. And so there's that aspect. And I've had a lot of thyroid cancer survivors, but other cancer patients reach out to me and say, hey, I loved your book. I take it with me to the doctor's office, because it makes me laugh when I'm sitting there waiting, and I love that. That's amazing to me that's helping people. And then, a lot of people with thyroid cancer that have questions, they read the book so that they can sort of understand what they're going to go through. So that's basically the book. There's a lot of different themes, and I think people will take their own message from it. And another very strong message within the book is that you need to be an advocate for your health, and I think you need to be an advocate for your pet's health. So if you think something's wrong with you, you need to push a little bit sometimes to get what you need to take care of yourself. And sometimes that means bringing in a friend or family member who understands medicine, if you don't have that background, because it's very confusing. Sometimes it means just asking the right questions. And sometimes it means literally just listening to yourself. If you have a new lump on your body, that's not normal, and you need to at least get to the stage of getting it biopsied to figure out what's going on. And don't ignore that, and don't ignore your health, and don't be sent home. Because that was one of the scarier things for me, is that I was literally sent home a couple times. Yeah, so I'd say, that's definitely another message is be your own advocate.
I guess you could sort of explain away why your surgery took 2.5 months. What doesn't really make sense to me at all is, why did the post-surgery diagnosis take a month and a half? Like that, I just don't, like that one, I really just don't understand. Did you ever find out a reason why such a long delay?
Yeah. I think it's for our patients, it's usually about 5 days to get histopathology back. I think it is a backlog. I think it's literally a backlog. And also, people in the thyroid cancer community hate this, but we're, thyroid cancer typically is called good cancer. And so I think I went
So it
down
wasn't a high priority in a way.
So I don't think it was a high priority. I think other types of cancer, and I guess rightly so. When you're in that situation, that doesn't feel very good. But would I give up my place in line to someone who has a cancer that, knowing that diagnosis 2 weeks sooner would make a difference for their overall prognosis? Of course I would. But it's very challenging when you're waiting for that information. A lot of the book, because it takes place mostly in Canada, but then part of it is when I was down in the States. And a lot of people have read the book, and depending on their political views, will say, well, socialized medicine's horrible. And that wasn't my message.
Right.
I'm very Canadian, and I really, if you can be very Canadian, but I think I really am. And I have very strong Canadian values, and I believe strongly in socialized medicine. And I was critical of some of the things that were happening to me at the time, because what I wrote about was literally happening in real time when you read that book. But in the end, I was treated. I'm 4 years out. I just saw my endocrinologist yesterday. I'm doing fine. And I would always choose, next year I got to celebrate on a party. But
Awesome.
I would always choose a socialized medicine where everyone has the right to high quality health care. But I think both systems, the Canadian system and the American system, have pretty deep flaws. And I think they could learn from each other, and I also think that people could learn from our profession, because I think as a rule, I'm very proud to be a veterinarian, because I think as a rule our veterinary professionals we have more compassion in our profession, and I think that was lost for me at in some of my interactions, that compassion.
How do you think your experience made you a better doctor?
I think it made me. I think that sense of urgency when you are trying to figure out what's going on, it's not even a sense of urgency necessarily to get to treatment. It's just to understand your disease. So waiting for your histopathology is painful, because you don't know what's going to happen to you. So I think I understand that when my clients come in and they have a sense of urgency, and sort of trying to explain to them, 2 days is not going to make a difference, or 2 months in a dog would definitely make a difference, but 2 days is not going to make a difference, and just try to allow them to go through the process, because we do things very quickly at our hospital, and most veterinary referral centers do as well. But there is always a rate-limiting step. Sometimes you do need to slow down a little bit, make sure the radiologist has had a chance to review a CT before you go to surgery, so that nothing gets missed and no mistakes are made. And so that's hard, because some of our clients come in and they're so stressed, and they're just like, they want to go now. They want surgery this afternoon. They want surgery yesterday. And so trying to help them with that stress, but also making them understand that, this process is happening so much faster for their dog than it would a person, and that it's going to be okay. But I think it has given me empathy for just that feeling of urgency.
Yeah. Okay. Take a step back. I mean, you told us a little bit about, growing up, you always knew you were somehow going to be involved with animals. Tell us a little bit about where you grew up and what was your childhood like?
So I grew up in a town called Canmore, Alberta, which is, if people know the Rocky Mountains in Alberta, it's just outside of Banff.
Oh, yeah. Only one of the most beautiful areas maybe in the world, right?
I think it is. I've traveled a lot and I've lived a lot of places, but I think I don't know, New Zealand has some pretty beautiful spots too, but yeah, it is very beautiful. If I could live there, I would. It's hard when you're a specialist to live in a small town, but it's an absolutely wonderful, it's a wonderful place. And then I moved in high school to Saskatoon, Saskatchewan, which is where at the time it was the only Western Canadian veterinary school. And I know people give Saskatoon a hard rap because of the weather there, but it's a wonderful city, just great people. It's a beautiful place as well. It has its own beauty. It's prairie, so it's different, but
Right.
it has its own beauty. And I think I had a very strong education at the University of Saskatchewan. I just had the chance to go back there and speak at the 50th anniversary of that vet college.
Wow.
And it was amazing. I mean, it was amazing to be back there, and I think they're doing wonderful things there at that college. And then I started my trek to become a surgeon because I had decided that that's really what I wanted to do. And I'll give you the short version, but I spent some time in general practice and then ultimately ended up at the University of Guelph and did my surgery residency there. And then I went to Colorado State University to do my fellowship in surgical oncology.
I've never been to Alberta. I mean, my parents have. I've never been to Saskatchewan, but I did grow up in Buffalo, so I think I may have spent some time in Guelph, and then I have been to Fort Collins, Colorado, where Colorado State University is. So definitely some really interesting places where you've lived, and of course Florida now, which is how do you like the humidity down there?
Yeah, so Florida's wonderful, except for in July and August, it's not. And I actually am getting really, really wimpy down here, which scares me for when I go back home to visit, as far as not tolerating the cold particularly well anymore. But yeah, it's a very different climate in almost every way that you can imagine.
Yeah,
well, politically. Just the weather, it's absolutely different. But the University of Florida is a great place to work. It's really allowed me to do some amazing things here because it's not that common to have a job that's pure surgical oncology, and so a lot of surgeons will work and do, orthopedics or everything or soft tissue surgery with an emphasis on oncologic surgery, which is also fantastic. But I just decided I really ultimately wanted to do pure surgical oncology, and so that's what brought me down here. And then there's a fellowship program at Colorado State University. We also have a fellowship program here at the University of Florida where we train surgeons to do this subspecialty of surgical oncology. So that's really satisfying for me to be able to train people in this field, because I think the more people we train, it just will elevate the level of care everywhere the fellows go.
Yeah. If a young person is listening to this, young man, young woman, what would you say it takes to be a good animal surgeon?
I think you need to love it. I always tell people that, you need to be quite driven, because it is, I think one of the challenges of our profession, and hopefully the millennials are going to help us with this, but it's challenging to have work-life balance if you're a veterinarian or any kind of veterinarian, but I'd say a veterinary surgeon as well. I think if you're just sort of going down the path of trying to decide if you want to be a veterinarian or not, I think getting exposed to what practice is like is important, because it's not for everybody. And so I think it's good to know that kind of early on, is this something I want to do or not? And I was exposed from the age of 8, and I knew that's what I wanted to do. But, you'll have some people that come in and they're in high school and they're volunteering, and then they just realize, I thought I wanted to do that, but actually I think I'm going to do something different. I think learning early on if that's really for you is a good idea. It also, unfortunately, it takes a lot of money right now if you're an American veterinary student, and so that's something that has to be taken into consideration. It's a huge problem across a lot of professions right now, is just the student loan burden. But I think one thing that, I hate saying this because I don't want to talk people out of becoming veterinarians, but the reality is that you will end up with the same amount of loans as a medical student, but you will not have the same salary when you come out. And when I was becoming a veterinarian, I didn't even know what vets made. I didn't care. It didn't matter. And that's fine, but I think it's probably good to kind of think about that. How is that going to fit into your life? And then something else which I think has to be a consideration, especially if you're looking at surgery as a field, is it's not that forgiving as far as right now as a profession, it's not that forgiving for people trying to do residency training and have a family at the same time. And it's when you are kind of ready to do a residency is about the same time that people start their families. And so I'm not saying that to discourage anyone either, but I think it's something that when you're in your 20s, you don't think about student loans. You don't think about, am I going to have kids or not? And that's for men and women, but I think you need to think about those things. That's just the reality of life, of, any profession. How is that going to impact your work-life balance and your family life, and what do you really want out of life? And so I think those are things that kind of need to be considered. And, they're all obstacles that can be overcome. And if you want to do it badly enough, you absolutely can do it. But you need a lot of support from your family to be able to do veterinary medicine in general, but also if you decide you want to go on and specialize as a resident. So I don't mean to be a downer, but I just think it is important to consider those things.
No, I think it's great. I mean, I think in the U.S. especially, I think people are, regardless of what line of work you go into, I think work-life balance is a huge issue. Less and less people are taking real vacations nowadays. For as one example, it's interesting how it seems like not the rest of the world, but a lot of the world is getting better at work-life balance. It seems like the U.S. in some ways is getting worse. I don't know if you have any thoughts on that. Yeah,
and even just comparing from Canada to the U.S., Canadians are kind of in the middle, I think, culturally between a European and an American. And so, but coming down here, I find, a lot of my colleagues don't take true vacations. I think sometimes there's a bit of a culture not to do that. There's also, I think, as email is still relatively new. We've only had email for about 20 years, and I think people don't know how to handle email.
Right.
As far as trying to turn it off, and it depends where you work and what your email flow is. But if you're at an academic institution, it is just a nonstop thing, the email, and something which I've tried to do, which it feels counterculture, not just in veterinary medicine, just in general. It feels counterculture, and I'm not perfect at it, but I really try to shut my email down on the evenings and on weekends.
Sure.
And I encourage people that I work with, my colleagues, if they need to reach me, to do that by telephone or text message if it's urgent. But if it's not urgent, it can sit in my inbox for the weekend, and then I'll deal with it on Monday. And that's actually made a big difference to me, as far as my work-life balance. It sounds like a silly thing, but I would encourage people to find that settings button on their phone where they can make the email stop, because it becomes a compulsion, and also it's a source of stress and insomnia. And even if they're good emails, but it's work emails, you're working, and I think It's important to try to take time out. I'm not the expert at that. If anyone looked at my life or anyone close to me heard me talking about this, they would say I've not achieved work-life balance, but I think it's a constant struggle, honestly, to try to find that and make time for things you love. And ultimately, you will be more creative, more productive. You will be a better employee if you are taking time out for yourself. And I think that is just a fact, and I just read an article that said after 55 hours a week, you max out and you actually become counterproductive if you're working more than that, which I definitely do all the time, work more than 55 hours a week. So I haven't figured out how to not do that. But it's an interesting fact. And working 80 hours a week it's ridiculous. You're being completely counterproductive. And so we need as a society, not just as a profession, but we need to look at that.
Well, it's great to hear from someone who, you truly deal with life and death, and to on the other hand, talk about work-life balance, I think is a powerful statement. So thank you for sharing that.
Yeah, you're welcome.
Pet insurance. Obviously, cancer treatment is going to be, I would imagine, pretty pricey. I have friends who, whether they have healthy dogs or dogs who are not so healthy, they are big believers in pet insurance. And of course, a lot of other folks are like, what's pet insurance? Do you have an opinion one way or another?
Yeah, I have a pretty strong opinion, actually. I'm glad you asked the question. My life would be so much easier and happier if I could just talk about the medicine and never have to worry about the money. And that's just the reality of veterinary medicine. Big cancer treatments in animals cost in the thousands, and there's nothing we can do about that. And I wish I could. And people think because I'm at an academic institution, maybe it could cost less, and it honestly just can't, because that equipment, the staff, that's just what it costs to do these very advanced treatments for our pets, which we want, but they come with a price tag. So I think, unless you're independently wealthy and you have a huge disposable income, which we know is a very small percentage of the population, and I'm not part of that. I have pet insurance, so I have a dog and a cat, and I have pet insurance for them because I don't want to even think about it when they get sick. I don't want to think about, I get a discount because I work at this hospital, but it's never free. It's not going to be, and I never want to think about the money if I'm making a decision about my pet. It doesn't mean I would treat every condition, but if you could just take that stress out of the equation, if you think about that, if you've got a pet, if you could just take away the money stress and then just focus on the stress that my pet is sick, I've got to listen to these options and I've got to make a decision that's the best decision for my pet and my family, but not have to bring money in, there's a freedom in that. And so, if you're a very rich person, you just get to have that freedom, but most of us are not. And I think it's important to think about having insurance. And there's different ways you can go about it. Some people have a lot of pets, and so insuring every single pet is just not a feasible option for them. For those people, I would say put some money aside every month to make a pet vet care account, and then you have the money when you need it. And if you never need it because all your dogs live to be 16 and are perfectly healthy, then you can go on a vacation or do something else with that money. But otherwise, I would encourage people to look at insurance. Not all pet insurance plans are created equal, and that's actually a bit of a source of frustration for me when I have a client who has paid their premiums every single month and, thought ahead to get insurance for their pet, and then they're not getting paid out appropriately. So I think that's another thing people need to look at. Some insurance companies will pay 80 to 90% of your dog's bill, and there's no maximum, and they don't look per condition. Those are the plans I would encourage people to get, and that's the plan I have for my pets. Gotcha. There's other plans that it's like you only get a certain amount per condition. If your dog has cancer, that's a condition, and if they're only giving you $1,000 of a $10,000 bill, why do you have insurance? I would say you don't need insurance then, if that's all that the insurance is going to provide you. So the vets know who pays out, and so, for anyone listening, I would say talk to your family veterinarian about what insurance they think would be good for you. And I would also say some of the insurance plans, they'll have these plans that cover vaccines and they cover dental prophylaxis and they cover heartworm. You don't need insurance for those things. Those are annual expenses that you can predict. Really you need insurance for my dog got hit by a car and broke their leg, or you need insurance for my dog has cancer and it's going to cost $5,000 to $8,000 for the surgery. Those are times when you need insurance. And so I think you can over-insure yourself as well. If you live in an area where there's heartworm, you have to buy heartworm pills for your dog. I mean, that's just a known expense. So I think try to be strategic with that as well, and look at the programs where it's really just a percentage and there's not a maximum. If you're getting into caps and maximums, or that they only pay out per condition, that's probably not good insurance for your pet. And I get pretty upset when people, I don't want to say which companies, but people can look up that information themselves. But when I see the one come out that has this person I know is only going to get $1,000 for one condition, and maybe we can kind of call it two conditions because they're also, they also have something else going on as a secondary health problem, but they're going to get, a very small percentage of their bill covered. Right. And they probably paid that. And, if you look at over that dog's lifespan, they probably paid that much money in premiums anyway. And so I would say be strategic and talk to your family veterinarian about what insurance programs they recommend because they know, because they're the ones filling out the forms. They're the ones that know, get the feedback from their clients. So which one is going to be a good insurance plan in your area.
You are just full of advice. Thank you so much.
Always.
How do folks find you, whether it's on Twitter, through your book? What are ways people can look you up?
Yeah, so Twitter is probably I really love Twitter. I just think it's a really fun medium and it's how I found you. So I'm thankful for that. So my Twitter handle is just Dr. Sarah Boston. So it's Sarah with an H and it's all one word. I do have a blog that I write sometimes, but I've been doing more guest blogging on my colleague Dr. Andrew Rourke's website because he has a lot more followers than me, and it's been a lot of fun working with him. And so that's sort of been, so you can sometimes find me on his website, or else my website is drsarahboston.com. So, those are kind of the best ways to find me. And then I have an author Facebook page as well, which is also Dr. Sarah Boston. So
great. Well, thank you.
Those are kind of the best ways to find me. And then, of course, I'm here at University of Florida, so most people can track me down that way too.
Have you been brainwashed into becoming a Florida Gators football fan?
Well, I do sincerely love being a part of the UF community and the Gator community because, I'm Canadian and I'm not used to these huge schools and the huge sports teams that they have down here.
It is a huge school.
Yeah, and at first I was like, wow, I don't know what to think of this, but there's a real community here. Some areas of Florida are not that progressive, but I would say the university is, and they really take good care of the people that work here. And so I feel lucky that I am here. I'm happy when the football team does well. Everyone's happy when the Gators do well. I haven't yet made it to a game, which is embarrassing to admit, but I will. I will get there. It's more just being part of the Gator community, though, that I think that is what I really enjoy. Yeah.
When it comes to game, baby steps. You may actually regret going to a football game. So
it's a lot. I think when I first moved here during football season, I've only been here for 3 years, and I had never seen so many motorhomes and then the satellite dishes and the tailgating, and so I think I got a little scared off, but I will get back in there.
It's a lot of fun, but it's basically an all-day commitment going to a football game. So
it is. Yeah, it absolutely is.
Yeah.
And the traffic's not going anywhere. It's very full on here when football season is happening. But
right.
It brings a lot to UF. There's people that are such dedicated supporters of our university, and
right.
I think that's wonderful. So yeah, I'm getting used to the culture of the tailgating and the big games. Yeah, absolutely.
Okay. Well, what does the rest of this year, what does 2016 look like for Dr. Sarah Boston?
Great question. I really want to write another book, and I'm trying to find, time and space to do that. Being on sick leave was good for being able to write a book because I couldn't really do anything, and some of that time I was hypothyroid, so I just had to sit around and entertain myself. But
right.
The day job is very busy. It's very wonderful, but it's also very busy. So sometimes finding that rested time where I feel creative is a challenge. So I'm working on trying to figure that out right now. I love writing blogs, so I'm hoping to write more blogs. From a work perspective, I am on the clinic floor about 50% of the time. Also doing some research in the field of canine oncology and speaking at some conferences. So I'll be going to Italy in March. In February, we have an organization called the Veterinary Society of Surgical Oncology, which I've been a part of since the beginning. And this is a group of surgeons with an interest in cancer surgery. And we have a meeting. It's our third meeting, and we have a meeting every second year. So it's our third meeting is in February in California. So I will be there speaking at that, and I'm so excited about it. And then for the rest of 2016, I think I have a trip to Colombia and a trip to Seattle for conferences.
Holy
so
cow.
I travel.
Whoa.
Yeah, there's a
freaking flyer miles.
fair amount of there's a fair amount of traveling involved in my job for partly some of the book tour, and then also just my academic job as far as speaking at conferences and in the area of cancer surgery, which is something that I absolutely love doing, and I'm really proud that I'm able to do that as part of my career. So, but it is a lot of traveling, and when you have a dog that you're pathologically attached to that is not small, that you have to leave at home, that can be a little bit hard sometimes. Yeah, sometimes the traveling is just a little bit too much. I try to take my dog with me everywhere I can, but he can't come to conferences.
Give us a 30-second. How'd you find your dog? What kind of dog?
He's actually on the cover of the book, so if anyone Googles Lucky Dog and my name, they'll see Rumble. He is from a shelter in Ocala, which is a town just outside of Gainesville in Florida. It's a wonderful no-kill shelter. He's a healer. Well, I know his mom was a healer. His dad probably was a shepherd. That's what we think. When you look at him, that's kind of what he looks like. But we also call him a Florida brown dog. And he's absolutely wonderful. He's I guess, the second love of my life because my husband's the love of my life. But he's probably a very close second as far as how much he brings to my life. And we're really lucky that we found him.
That's great. Finally, last question. I guess any sort of last advice you would give to folks in the animal rescue community, just the animal lover community, from your perspective?
That's a great question. From an animal rescue perspective, we still have to promote people spaying and neutering, being responsible pet owners, keeping animals leashed and protected, because ultimately, if you can't keep your population healthy, they will never live long enough to develop any of the treatments that the specialists are treating. And so we need to, I think, get back to basics. There's been some fears about, should we vaccinate? Are we over-vaccinating? Maybe we are, but vaccines have eradicated parvo and rabies, and we still have rabies in wildlife and dogs in this area. So I think we can't abandon the advances we've made in keeping our pet population healthy. I think as far as, rescue, that's a very difficult job. I wrote about it in my book as well. Actually, when I was a teenager, I worked at a shelter. I think that's one of the hardest jobs I've ever done, actually, is taking care of these pets that people didn't want. It's absolutely heartbreaking. Some people in our society still regard pets as being somewhat disposable, and I'm moving. I'm not going to take this dog with me. I'm just going to take it and dump it at a shelter. And I don't understand that mentality. I don't understand, if you live with a dog and they're part of your family, how you could ever do that. But it's still out there that people do treat animals like that. So I think it's good for me to connect with that and understand it, because I'm in a completely different world where people are the other extreme, where they think of that animal almost as a person. They would rearrange their life for their dog. And so for me as a veterinarian, I think it's important to always keep that full spectrum, and that there's all different perspectives on animals. And I think the most important thing for me, I don't think everyone should treat cancer in their pet. I mean, some people, they don't have the time, they don't have the money, it's just not something that they're able to do. And I think that's okay. I think the only, advice I have is that we need to make sure those pets have good welfare. We need to make sure that they're comfortable, that they're eating, and that, whatever treatment people decide to do is that it's humane. And so sometimes that means euthanasia, and that's okay. If you have a pet with osteosarcoma, which is a really painful bone cancer, and you can't afford to treat them, no one should ever make you feel bad for deciding to stop and euthanize that pet. And that sounds strange, but I would rather do that than see that pet be painful for months and months and not have a good quality of life. And so I think whether it's a rescue dog or a dog with cancer, quality of life trumps everything.
Wow.
That's the most important thing. Yeah.
Thank you so much. That was amazing. Just want to say thank you to Dr. Sarah Boston. This was incredible. You gave me way more information than I ever would have expected. Just really great advice and life advice. So thank you.
You're welcome. Thanks so much for reaching out to me and for having me on your podcast.
Thanks to Dr. Sarah Boston for sharing her story. Who knows, maybe one of you is our next great veterinary surgical oncologist. That's a tongue twister. If you want to learn more, go to our show notes at thisispawprint.com/3. If you want to learn more about Nancy and myself, you can find us on Facebook, Instagram, Twitter. Look us up at This Is Pawprint. If you enjoyed today's episode, go to our iTunes page and leave us a review. You can find us at thisispawprint.com/iTunes. If you leave us your Twitter handle, we promise that we'll return the favor with a shout out. Thanks again for listening. Take care and see you again on Pawprint.
Pawprint is a production of EVER Education.
You get